Hello, today we're going to be doing the standing hip flexion test for you. And in order to do this, I'm going to palpate the PSIS bilaterally. And so I will expose the area here, and then I'll ask my patient to go ahead and bend forward. All right, very good, and come back up. And what I'm feeling for is symmetry of the PSIS. And if there is asymmetry, I'm going to be feeling for the one that goes more caudally or superiorly. And that might suggest some pathology of that side that is more hypermobile. I don't like the numbers that I found. I have a sensitivity and specificity of 0.17 and 0.79 respectively, and the positive and negative likelihood ratios I found in our lecture of 0.81 and 1.05, which once again, those don't really give us a whole lot of information whether we have a positive or negative test. The next test that we're going to do is the standing hip flexion test, also known as the Stork or the Gillette test. And so this one I'm going to have, I'm going to once again palpate the PSIS and the S2, S3 of the sacrum. And I'm going to have my patient lift up her right leg for me. Very good. Bring it back down. And then once again, I can have her do it on the left side to test bilaterally. And what I'm testing for there is the PSIS moving inferiorly. If it does move anterior, that would be a sign of a positive test. And the numbers I found for this, once again, I'm not a big fan of. A sensitivity of 0.43 and specificity of 0.69, and the likelihood ratios I found in our lectures, positive of 1.31 and a negative of 0.83. The last test that we're going to do is the sacral thrust test. What we're going to do is palpate the S3 of the sacrum, and the book says to vigorously and repeatedly up to 6 times thrust into the sacrum, and almost look like we were given CPR there. We're going to be looking for pain and reproduction of symptoms. The numbers the book has is a sensitivity of 63% and a specificity of 75% and a positive likelihood ratio of 2.5 and a negative of 0.49, which are all only okay numbers.